This is the 2008 Cover the Uninsured week, and it's a week that's grown tremendously over the last 5 years when it first started in 2003. The week and the organization behind it have been instrumental so far in generating unprecedented support for extending health care coverage to the uninsured and generating collaboration among the various stakeholders. As we begin our discussion today, please be aware that 3x5 cards are available for you to write questions on, which the panelists will be able to respond to later. They're at the end of the desks. Please take a few, and at some point after each speaker, pass them in toward the middle aisles, and we will collect those. And when you have written a question, pass them in. Also, if you could please remember to turn off your cell phones or put them on silent, that'd be great. The organization behind today's panel is the Center for Healthcare Research and Transformation. The center was formed in 2006 as a result of the University of Michigan's sale of its MCare health plan to Blue Cross Blue Shield of Michigan. Combining the research strengths of the university with the health plan expertise of the Blues to test the best ideas for improving healthcare delivery, financing systems, population health, and access to healthcare. Our first speaker today will be Marianne Udall Phillips, who is the center's first director. She was appointed in September 2007. Marianne has a master's degree in health services administration from the University of Michigan School of Public Health. Marianne has served the healthcare field in a number of leadership roles. Before she came to the center, she was appointed by Governor Jennifer Granholm to direct the Michigan Department of Human Services. She came to state service from the Blues of Michigan herself, where she served in a variety of leadership roles over 20 years with the organization, most recently as Senior Vice President of Healthcare Products and Provider Services. She also is involved in the community in a number of other ways that are too numerous to list. So, Marianne?
Thank you, Tracy. By the way, I notice everyone gravitates to the back, but there are some seats here in the front for those of you brave enough to come forward, and we hope you will come join us so that you can see and participate in the dialogue. I am delighted to welcome you here today on behalf of the Center for Healthcare Research and Transformation. As you heard from Tracy, we are a joint venture of Blue Cross and Blue Shield of Michigan and the University of Michigan Health System with a goal to help find ways to improve the quality of healthcare, the efficiency of healthcare, and access to healthcare. And of course, our topic for today, focusing on the uninsured, is a very important part of our mission, and we do have a special goal to help to contribute to the dialogue to achieve universal access to care. We carry out our work at the center through conducting demonstration projects, engaging in studies, and also supporting public information and education, which is, again, what we're doing here today, to really highlight and talk about ways to solve very complex issues. And today's issue is an issue that has been around in this country since at least the turn of the 19th century, and we have yet to find a solution. I know that I would not have to poll this particular audience to see whether you felt we should have universal access to health care in this country. I can guarantee you that the vast majority of you do believe we should have universal access, as do the vast majority of people in the country. And people in this country have felt that way for a very long time. And yet, as you can see, today we have still 47 million people who are uninsured in this country. And in fact, at the kickoff for Cover the Uninsured Week this week, and I did want to acknowledge Doug Halliday and Patty McCarty, who are in the back of the room here, you could wave, who are the staff for the Cover the Uninsured team, and we had a wonderful kickoff in Detroit this week, where we brought many people in for a health expo and had many speakers to talk about the importance of this issue. And at that kickoff, Mayor Kilpatrick talked about the situation in the city of Detroit alone, where he noted that there were 200,000 people in the city of Detroit with no health insurance. That's in a city of almost 1 million. That's a tremendous, astounding statistic. And it's certainly not a way to sustain a vibrant, growing city if people can't get their health care needs met. And so I'm not going to go through any of the details about the numbers behind the uninsured, because Catherine is going to do that in great depth and really in very important ways. But we all know that this is a huge problem of great magnitude and a problem that we need to address. And so the question is, why haven't we? And I want to just leave you with one quote because I really want to leave enough time for our wonderful panelists who are going to give you such great perspective on this issue. And it comes from a speech I heard given by Stuart Altman a couple of weeks ago. For those of you who don't know Stuart, he is a professor at Brandeis University. He's been engaged in a very direct way in this healthcare debate and healthcare reform since the early 1970s. He's served in 6 presidential administrations trying to solve the problem of both the uninsured and the growth in healthcare spending. And as he says, he's a colossal failure on both counts. But he has tremendous insight into the issue. And one of the things that he shared at the meeting that I heard him speak at, which is, I think, a terrific perspective and a great way, I think, to launch our dialogue today, is that in Europe and in, there is universal coverage in virtually every developed country in the world, but in Europe and those who have universal coverage, they see health care as a social good. In this country, we see health care as a business. And I think that distinction is truly fundamental to our understanding what it is that is the barrier, where the biggest barriers are to changing the system. What keeps the status quo so intact in this country? It is that very different philosophical view of the healthcare system. And as I said in my piece that I wrote for the Ann Arbor News, today, 1/6 of our economy is healthcare. And so making a change to that system is a tremendous challenge, even though, again, the vast majority of us think we need a fundamental change. And so that's what we're going to talk about today. Just a word about what we've asked the panel to do. Catherine, who you'll hear from Tracy in a minute, all of Catherine's tremendous background to speak on this issue, is going to give you a perspective at much greater level of depth as to who the uninsured are and what it is some of the myths that we believe about the uninsured. And I think it's really going to help us frame this issue. I think she's also going to talk a little bit about the presidential candidates, their platforms, some of the ideas that are being floated about how to solve this problem. Ellen Rabinowitz, we've asked to talk about a local solution. She's working really within the current system to create a safety net for those who don't have coverage, and we've asked her to talk about how the safety net is working and an area of whether that is a solution or not. And then Kevin Seitz is going to talk give you some perspective on the nature of this debate and what is possible in a political climate and how can we make change, and hopefully leave us with some tools and some levers that we all might go forward and work on this issue. We hope today is the beginning of a dialogue, not the end of a week. It is very important for us to walk out of here thinking about how we can all together address this issue and make a change for those who are so in need. So I'm delighted to welcome you here today. I'm delighted to kick off this panel, and I know we're going to have a very lively discussion.